I don't know. It could happen. It could be Susan today.
So we have Laura. She's from the American Lung Association. So she's been working with us here, and she came to share some of the resources that they have in the organization.
So I'm gonna, yes, thank you. Thanks, Kate. No worry. So I'm a volunteer with the American Lung Association. I've been a volunteer with them probably for about 6-7 years. And part of it was I moved here a year ago from Connecticut. I worked in skilled nursing for many years, and we used to have specialty programs for pulmonary. And so we hosted a Better Breathers group at a couple of our communities. And when I came down here, I kind of wanted to continue doing it. So now I work for Vital Caring Home Health, and we can see any of our clients with pulmonary or for any medical reason as a home in the home health at home. So I wanted to share an overview. Whoops, it went blank. It'll come up though. Of the American Lung Association and all the resources. As I mentioned to the earlier group, I received this PowerPoint yesterday. There's a lot of pages, a lot of information. I'm going to just kind of focus on some of the areas that might be helpful to you, and just so that you know where to turn if you need more resources. And of course, I'll share my card with my number, and I can always be a resource as well, or at least direct you to the right person or agency if you need more information. So with the American Lung Association, their mission and their mission really involves education, research, and advocacy. And with the have any of you ever attended the Better Breathers Club? It's here on the second Wednesday of the month at 11:30, and we have different speakers throughout. Thanks to Oscar. He started the club, not under the American Lung Association Better Breathers, but just as a support group. And I can tell you it's a wonderful group, and it's very engaging, and you get a lot of resources. So education is, so I would say the Better Breathers falls under education. There's a lot of research that goes in. As a matter of fact, since 2000, 225 million has been invested into various areas for research. And then advocacy. And I always say we always want to be our own health advocate, but they become a great resource as well in sharing updates and information on lung disease with providers and the specialties. So education and support. Some of this you're going to notice I'm going to go fast on because I couldn't edit this. But this is the website page. And although I was going to originally use the website as a guide, I said I'm going to use this presentation because I think it has a lot more information in it that I would have been able to pull out. So if you go to the American Lung Association, and actually it's lung.org. I had ALL.org, but it is the lung.org. And I think ALL will pull it up too. But if you go there, you can navigate through. And this, the next slides will kind of go through some areas that I'm highlighting. So lung disease, lung health and diseases, that's an important piece that I think many of you might be interested in. Policy and advocacy. And there's also opportunities to see what trials are being done locally if you qualify, and other research information. Lung disease, lung health and disease, it goes by whatever, this is the first block. And then there's lung health and wellness, how lungs work, warning signs, lung procedures, tests, and they give you some great information if you're having any tests being done, so you get information in advance, because I think a lot of times it's really hard to know what to expect when you don't, but by being able to reference this, you might get a lot of good information. And then healthcare provider resources is more for exactly that, healthcare providers. And Lung disease lookup. So you can start when you're under the lung disease lookup. You can go based on whatever your diagnosis may be. For example, asthma, bronchitis, COPD, and you just will drill down and it will give you information like, for example, COPD. And then you can key in whatever you want to look up. But I also, if you're a caregiver, you can look under caregiver information. If you're a healthcare professional, you can look under that. Or if you want to learn more about it, and if you're living with COPD. So that will like navigate you into the next pages. They also have accessibility options, which I think is great for somebody that might be blind, cognitive learning issues, ADHD, etc. So information on lung disease. It's what you like, for example, they have a few things up here, but let's say you went into asthma, there'll be a block on what you need to do, what to do after your diagnosis, and how to manage. The same thing if it was pulmonary hypertension, pulmonary fibrosis, bronchitis, whatever it may be, and of course COPD. And if I could ask if anybody want to volunteer, how many here have COPD? Okay. How about pulmonary fibrosis? Asthma? Okay. Okay, great. I just like to know because then if there's anything particular, I can kind of stop.
I had COPD, but then I had a lung transplant.
Okay.
So 5.5 years post-transplant.
That's awesome.
But I've had some
Bumps in the road.
Yeah.
So you're here to
So
triage. Yes.
Welcome to my brother.
Yes. Oscar had a lung transplant as well. So, and it's always good to know your resources, as you probably know, because you're kind of triaging your next steps. So I think this is great information. And again, it's on the website. A lot of times when you're going to see your doctor, you might have questions. And this is just a good reference point. For example, it talks about the specialist name, you list your other providers. And a lot of the reason for this is that your specialist will then know who your other providers are. If you're in network with NCH, and now there's so much online with the portals and with the, they're able to kind of talk to each other, but this is information you can give your doctor so they have it and they can put in. You tell them all your medications, even over-the-counter medications, that's always important, and then any symptoms and tests that you've had. So it's a good reference point. The supportive care quiz is up there in terms of somebody that might just to be able to answer, and they can give you options for services that you may need in the community. Medication tracker and palliative care. I had mentioned again earlier, when we do the Better Breathers Club meetings monthly, there's a different topic at each meeting, and we are going to be bringing palliative care in. Palliative care can really support those living with any pulmonary disease, and there's just a lot involved in it, and it's really hard to, we need the program to do it. But in a nutshell, if you have your insurance can cover it. And if you qualify, a lot of people that are dealing with pain management post that have lung cancer, there could be a lot of reasons where palliative may come in, and they work with your provider, your primary provider, to provide extra support. A lot of people hear palliative and hospice because they're together. They think hospice, but it's really palliative manages a lot of chronic medical people with chronic health conditions. So just to bring that up. There's a COPD booklet. It's a free resource. It's available on the website. What I like, and I mentioned this before, it's written in so that, it's not in medical terminology. So it's really to understand. And they've really done that where it's they call it medical literacy, if you will, so that we can understand. Because a lot of times, I'm not a clinician myself. It's really important that you as a patient know what they're asking, what they're recommending, and that you can understand your diagnosis. I like to talk about this a lot. We used to use them in skilled nursing, the zone tools, because one of the things that you want to be able to do is stay healthy or at least avoid being hospitalized, because there's changes in condition that can happen from hospitalization. You can decondition. And so whatever you can do to prevent that ER visit, which is usually in the red zone. So as an example, a green zone for COPD, not wheezing or asthma, you're breathing easily, no cough, you're not wheezing, normal activity. If you start having a change where you're coughing up, where you're coughing more, short of breath, that is the yellow zone. And when you hit the yellow zone is when you want to either call your provider. There's lung navigators that you can reference on the web, that you can call through the website for the American Lung Association. I'll share more on that. Or if you're working with a home health agency or outpatient pulmonary, let them know. Now, just to understand, you wouldn't most likely be on home health and coming to pulmonary rehab unless you had a change in condition where pulmonary rehab, you're not coming, and then, home health, because you have to be homebound, and then home health would discharge you back to pulmonary rehab. So that can work, and we can work nicely together. And I think that these action plans are a great guide. If you have pulmonary fibrosis, usually it's more specific in plan, because your doctor will say, if you get a cold, for example, and you're coughing, or if you're noticing a change with your oxygen levels on a regular basis, whatever it may be, the doctor will give you a specific plan as to when to call. There's a lot of educational videos, whether it's healthcare providers talking, patient stories that you can look at from the website. That's more educational. And then how-to videos. And one of the topics that we may discuss in the next 12 months of our Better Breather group is I brought in respiratory therapists to really talk about using inhalers properly. And that is really important. I mentioned this earlier, the pursed lip breathing. A lot of times, what you'll see is when clients get short of breath, they pant, and it makes you more panicked. That makes you more short of breath. So the pursed lip breathing exercises, we used to give out harmonicas, because when you play harmonicas, it helps with that. You can blow a whistle, yeah. But it's about breathing in through the nose and breathing out slowly through the mouth, so your lips are pursed. And it does relax you. In through the nose, out through the mouth. And that's something that many doctors will recommend that you do if you're noticing that you're struggling with, kind of catching your breath. So lung health and wellness, that whole page. So that was the next block. And there was, knowing your whatever lung disease or lung diagnosis you have. The next block was lung health and wellness, protecting your lungs, exercise, breathing exercise, and vaccines. I always say this. People will say, should I get this vaccine or that vaccine? I always say you have to ask your provider what vaccines are recommended and follow their plan. Because even if I was a clinician, I'm not your doc, and there's different reasons, and it's really important to ask your own doctor. Would you agree, Katie?
Yes.
Okay. And then the different exercises, pulmonary rehabilitation is a perfect example. And they talk about pulmonary rehab on this. And I think that NCH Pulmonary Rehab does every time I come in here, there's a lot of people, and that's awesome. And so my mom went to pulmonary rehab. My best friend growing up is a respiratory therapist for a pulmonary rehab back in Connecticut. There's always a lot going on. And I think in addition to the exercises, there's the support that you receive. stretching, aerobic activity, and resistance training. And a lot of it is doing some resistance training and strengthening training is really good. Not only it's good for your heart and your lungs and everything, not just your legs and your arms or your stomach. So it's really important overall, whatever you can do. Lung procedures, tests, and treatments. So they bring up on here one of the diagnoses and the tests that are involved, so you can learn whatever the treatment is that you might be having, how to prepare, what to expect, understanding results and risks. And this is where I was mentioning earlier the advocacy for yourself and knowing in advance. And for those of you that have had tests done, you may agree, like you get anxious and then you don't know. And then if you look at your my chart for results and you try to read into it, it can be very challenging, because I can only speak for family members that do that. And I'm like, please don't try to self-diagnose. And so it talks about all that. And there's, for every different test there's different information as to what it is and how to prepare, etc. The basics. So sometimes you can get a lot of the information you might be looking for just by doing a webinar too. If you're newly diagnosed with something, and you can go and look on their website for that. Talks about risk factors, preventions. One thing that I always say, there's triggers involved with COPD and asthma. It could be a certain scent. We always know that you don't really want to wear perfume around somebody with COPD and asthma in particular. I don't know, is that true with pulmonary hypertension as well?
It is.
It is.
When I had my condition, perfumes and all the chemicals that they use
For
to clean
clean,
houses,
yep.
Around the house,
Yeah.
they really gave me an exacerbation. Most of the time, they were just giving me the exacerbations of that.
Exactly. And so, just to prevent those exacerbations, or at that point, you might be in the yellow zone, so you may want to check with your doctor if you find that you're, having trouble breathing. And the other is air quality. So there's more information on this website on how air quality can affect you. And I always say, like in the Northeast, when it gets really cold, it can affect those living with lung disease. But when it also gets really hot, what I found amazing here is when I used to do the Better Breather up in Connecticut, we never held a club meeting in July, August. Well, here people are used to it more, and that could be part of it because you have heat. It's warmer all the time here. So the weather could be one example. Fireplaces, that the smoke from the fireplaces, which I think there's less fireplaces being used here. So, and you can also get information on the latest medications and treatment. Asthma basics, example, they talk about triggers, asthma action plan, just like we did with the COPD. Pulmonary hypertension. This is a newer area of focus that's been on the American Lung Association website, not like most recently, but the focus of the American Lung Association at one time was really to help people stop smoking and lung cancer. And they've expanded now more. And there's a lot being done with testing so that you can diagnose lung cancer sooner. So it talks about that. Infectious respiratory disease. So one of the things that I always like to say is that if you get your flu shot and other shots, you prevent infection, that only can help. But if you do find that you have like pneumonia, for example, pneumonia obviously will affect you if you have a respiratory condition underlying. So you want to make sure that you don't wait and that you get checked. Each breath, blog sites. So there's blogs on there, more information. So whatever may be your way of finding information, you can check. Blogs again, support options. this is really, I think, a great resource. So if you have trouble reaching your doctor's office over the weekend and talking to a nurse or your provider, you can always use the lung helpline. You can use them anytime. They're nurses, they're respiratory therapists, and they're also they're trained in, like, with Stop Smoking Initiative too. But I think for most of those of you that would be here, it's really about the nurse, the registered nurse, and the therapist. And you can call in those hours, so they're available. And they're very much trained and educated on being able to answer questions or at least direct you in the right direction if, I think we're all aware that we never want to answer a question that we really don't know the answer to, right? And so they'll find out. But it's bilingual, and as well as many different languages, 250 languages with interpretation. And this just is a comment that one of the patients lists that, well, I'll just read it because it's good, is with everything else you provided for me, and especially for giving me someone to ask my way too many questions about illness, I'm very grateful. And I think this is important because a lot of times we feel when we call the doctor's office, we have a limited window and we only get out what we really want to ask because we don't know if we're going to have time with the nurse. If you feel that way and you want, and you want to talk to somebody different, you can always call. But I always do say this, and I can speak for Connecticut, is that a lot of times if you go to the doctor and you forget, and you might have some questions and you forget something, the triage nurse that answers the phones in the office can be a great resource. And I always recommend, call back and ask them the question. And I think that is much, and I think this is also important, one-on-one communication. You have this as a resource, so you can use the blogs, you can use the technology, but a lot of times you can't get a question necessarily answered. So that's where it really works well. And these are specifically with the lung navigators, understanding your diagnosis, treatment, seeking a specialist or a second opinion, lifestyle changes, and insurance coverage. So if insurance is complicated. So if they can give you if they can provide any assistance, that's always helpful. But what we found out was with that Smart Vest, it's all on the diagnosis code, and insurance will pick it up. And this is just talking about the different programs, learning to live with COPD and breathe well, live well, and just different ways and different programs. And they just said that pulmonary fibrosis was just added in July 2025. So the COPD is for those with COPD and their caregivers. You can receive one-on-one education via phone or Zoom. Program schedule, it's flexible, but over 2 to 5 weekly calls. They discuss using medication delivery devices, breathing exercises, supplemental oxygen, and resources. And then asthma has similar, but a little different information. The workbook. So a lot of times, and in our home health agency, we have a workbook that we use with clients when they're on service. And it talks about everything about knowing your diagnosis, understanding your medications. I always say this, that if you're coming out of the hospital and they're changing your medications, it can get complicated because what do I still take? And you want to make sure. So home health definitely helps with that. But understanding your medications, managing your condition, nutrition is so important. Certain foods you may want to avoid if you have COPD. For example, obviously you want to watch your salt intake with that. But sometimes fats saturated fats, for example, can affect your breathing. You want to kind of limit that. Canned and fast foods, high in sodium. And then you want to always limit your simple carbohydrates. But this is a way that you can utilize an educational workbook, a little different, but it's something that you can utilize for different diagnoses. Asthma. Pulmonary fibrosis. That's great. And I saw that. And then patient and caregiver network. So there is a network with information for both caregivers and those living with lung disease. Wellness Hub has more information. Better Breathers clubs that we talked about, I guess they started in 1972. There is a link, so when you go on and you look up Better Breathers Club, if you put in our zip code or you put in any Naples zip code, this club will pop up. And then Oscar also has a website that he created in CH Pulmonary Rehab. And that is not linked to the American Lung Association because they have certain regulations involved, but they do know about the website in case people ask. So that's good information if somebody calls. And clean air. As I had mentioned, air quality can really impact how our ability to breathe, especially when you have COPD or asthma. How to check air quality. I was going to go through that. Quit smoking. That resource is always available. Resources. Research. And I know I'm going really quick because they gave me like a 50-page and it's a PDF, so I can't edit it. So I just want to go through. They do a lot with research, and you can always check, as I mentioned, on clinical trials available. And the clinical trials are regulated through the Food and Drug Administration, and they're always looking to expand. There's a few ways that they raise money. They do a walk, what's it called? The air climb. Have you ever seen the air climb around here where they walk up? It's, they did one in Hartford and I had a tabletop booth, right? And somebody said, you want to do the climb? Fight for Air Climb is the name of it. It was one of the biggest buildings in Hartford and it was a lot of steps. So I'm like, sure. So little did I know, but I did it. For 3 days, my lungs hurt. Yeah, because I didn't prepare for it. And it really gave me, though, an understanding of what it is like to fight to get air and how stressful that can be. Advocacy. They do a lot in order for, the Lung Association does a lot to be able to make sure they're not only advocate for you, but they're advocating to health professionals on different information and research. Oh, there's the Fight to Air Climb. And the firefighters go up in all that gear. They were all ahead of me. And become an advocate. So I guess you could call myself an advocate. And I am an advocate by working with the community, with the Better Breathers Club, because any information that can help you and in your process of living with respiratory disease, I'm happy to be able to support. And I have a card. My card is going to say Vital Caring Home Health because I don't get cards for the American Lung Association, but my cell phone is on there. Oscar can be a resource for you as well. And our mission, save lives by improving lung health and preventing lung disease. And like I said, they've come a long way over the last couple of years because they're really starting to incorporate other diagnoses, including those that do have lung cancer. And they've made a lot of strides too with lung cancer. So,
Right.
anybody have questions? Is there any more information that would be helpful?
I think you've covered just about everything.
I think I did. Pretty quick too. That was a quick.
Thank you, Sue.
Let me just introduce myself now.
No, I was gonna. Yeah. Oh, they don't know you, Oscar?
No, I didn't introduce.
Oh.
We were just waiting on you.
Oh,
to
I'm sorry. I
give
thought
information.
everybody
But
knows
anyway,
Oscar, so I thought they did.
First thing first, I'm a double lung transplant recipient. I had pulmonary fibrosis. So isn't having a double lung transplant is not a cure. It's just change one condition for another, but it's a better quality of life. With that, my name is Oscar Escobar, and I've been working here with NCH as a patient for almost 6 years now. Ever since I was diagnosed with pulmonary fibrosis, I started to do my exercises over here, my rehab, and even after my double lung transplant last year, I still coming here every Tuesday and Thursday to do my exercises. In addition to that, I have created the club. We call it the club to make it more fancy. So everybody, by all means, you are all part of the club. You can join by getting on the website. By any chance, can you get on the website and show them? Yes, the
Yeah.
website
Yeah.
on the computer.
And I have some, if anybody wants a flyer for the Better Breathers, it's right here.
So the website, it's NaplesPRClub.com.
And I can
It's-
go over with them too.
Yes.
Next sessions, we can do that also. Which I did already, some of them.
On the website, you will find the information of what we do every month, the meetings that we are going to have, the past meetings that we have, the social events that we're having outside of the building. So by all means, I invite everybody to join the club. There is no charge for it. It's all free. You will have monthly letters with information about COPD, pulmonary fibrosis, and hypertension.
What is the web address again?
www.
Yeah.
Yeah, just if you go.
Oh, let me put it back up here.
Oh, I thought you put it in here, but I guess not.
No, they won't. It doesn't. Because it drives it there. Yeah.
NaplesPRClub.com.
You got a .com. Yeah.
And that's our website. And I call it our website because I want everybody to participate, to give us ideas, to connect through the website, to if you have any information available. I got information on the website for new research, medicines, researchers that they're doing all over the state, pretty much, because I don't think you want to go out of the state if you want to have any research or participate in a research or anything like that. So mostly will be local and throughout the state.
And the next speaker is Dr. Carl Ruthven. Yep. He'll be coming in next week.
Next week,
Yep.
December 10th at
11:45.
11:30.
11:30. Yep.
He will be here. So everybody's invited.
If you want to participate in this one, you can, because that's going to be on Wednesday. You're going to be here anyway. But it's going to be in a different time class. If you want to come to this, you can change for that day the class. So you do exercises and then you see the doctor speaking here. So that's a choice that you have. If you want to change for that day.
And if you go to the American Lung Association website, the Better Breathers Club will pull up, and it gives the information on here and where it is. So it's all there too. So if you go, all you have to do is just put in Better Breathers Club Naples, and it will pull up the meetings. So it's great, and it tells you when. Yeah. Yeah.
All right.
So we'll expect everybody to participate and to collaborate with our group, with our club. So we are a special club.
Any questions? Because we need to go back and finish,
Yeah.
right, with the sessions.
Yep.
But if you have more questions or anything else, then they're always available, and you can also talk to me.
On the website, you will find her phone number and my phone number.
Oh, you have it.
Yeah.
The
Yeah.
emails where you can connect and ask any questions if you want, or you can call us directly.
Absolutely.
Thank you, everybody.
You're welcome. And I'm glad that you're back on trying to get,
We'll see.
yeah,
So I met you
you got your action. It was
Go
nice.
back to the gym.
several years ago.
Sure.
Before your
Which
transplant.
one?
Yes.
The flyer?
Last
Oh,
year.
Okay,
Oh,
Last year.
so I had my transplant
Today's the one updated, I don't know.
almost
Yeah,
it'll be
the-
Let me
6
see
years
if this
next
is
month.
new.
there you go. What's your name?
Nice.
And
What's your name?
I
Alan,
used to
nice to
come
meet you.
lung